Hello everyone, this is Shakti Abhinaya Tangaraj of Group 3. Today I am going to speak about nerve supply of the stomach and the surgical treatment of the duodenum. The stomach is the important organ in the digestive system. It helps in digestion of the food through gastric secretions and hydrochloric acid, which is secreted by the parietal cells. The nerve supply of the stomach is of two types, sympathetic and parasympathetic. The sympathetic nerve supply arises from the T6 to T10 of the spinal segments through greater splanchnic nerve, that is preganglionic sympathetic nerve. The functions of the sympathetic nerves are: it decreases the gastric movements or gastric activity, and it decreases the acid secretion, and it controls the parietal cells and the pyloric sphincter. Pyloric sphincter is the opening between the stomach and the small intestine. That's the passage of the food between the pylorus part of the stomach and the first part of the duodenum. And the sympathetic nerve supply generally decreases the gastric secretion and the acid secretion. Thus, it is called as the inhibitory nerve supply of the stomach. Now, let's see about parasympathetic nerve supply. Parasympathetic nerve supply through the vagus nerve. Vagus nerve increases the gastric secretion and the hydrochloric acid secretion in the stomach. The vagus nerve is of two types. There is left vagus nerve and the right vagus nerve. Left vagus nerve forms the anterior vagal trunk and the right vagus nerve forms the posterior vagal trunk. The vagus nerve supplies to the different parts of the stomach. The functions of the parasympathetic nerve supply is: it increases the gastric acid secretion, and it increases the gastric movement and gastric activity, and it helps in digestion and promote digestion. And the parasympathetic nerve supply generally increases the gastric activity and acid secretion. Thus, it's called as the stimulatory nerve supply of the stomach. As we know that vagus nerve supplies to the different parts of the stomach is of two nerves, that is nerve of Gracie and the nerve of Lymphatic. Now let's see what is nerves of Gracie. Nerve of Gracie supplies to the fundus part of the stomach. It's the most important branch of the vagus nerve. The fundus is the upper rounded part of the stomach which stores food and gas temporarily. The nerve of Gracie is clinically important because if it is not cut properly during the duodenal ulcer surgery, the acid secretion may continue and the ulcers can be reoccur. Now let's see what is nerve of Lymphatic. Nerve of Lymphatic runs along the lesser curvature of the stomach. It supplies to the parietal cells. Parietal cells produces hydrochloric acid. The hydrochloric acid helps in the digestion of the food, but the excess secretion of hydrochloric acid can damage the mucosal lining of the duodenum and cause duodenal ulcer. Now let's see what is duodenal ulcer. Duodenal ulcer is a sore wound present in the first part of the duodenum. Well, first part of the duodenum is the most common site of the duodenal ulcer. The common causes of duodenal ulcers are improper food habits, indigestion, and the excess secretion of hydrochloric acid. The symptoms of duodenal ulcer are burning and pain in stomach, indigestion, nausea, and vomiting. To reduce the hydrochloric acid secretion, surgeries can be done. The most important surgery is highly selective vagotomy. In this surgery, the nerve of Lymphatic, which is supplying the parietal cells, will be cut and the parietal cells will be denervated. So the acid secretion reduces and the ulcer formation is also reduces. As I said before, the right vagus nerve forms posterior vagal trunk and the left vagus nerve forms the anterior vagal trunk. The posterior vagal trunk is of two branches, celiac branch and the gastric branch. In this gastric branch, there are two nerves, nerve of Gracie and the nerve of Lymphatic. The nerve of Gracie supplies to the fundus part of the stomach, and the nerve of Lymphatic supplies to the lower curvature of the stomach. And the first part of duodenum is the most common site for duodenal ulcers. And the anterior vagal trunk supplied by the left vagus nerve is of three branches: hepatic branch, celiac branch, and the gastric branch. The gastric branch is supplied by the nerve of Lymphatic. Now let's see a short recall. The nerve supply of the stomach is of two types, that is sympathetic and parasympathetic nerve supply. The sympathetic nerve supply generally decreases the gastric activity and acid secretion, and the parasympathetic nerve supply generally increases the gastric activity and acid secretion, and the nerve of Grassi supplies to the fundus part of the stomach, and the nerve of Lateral supplies to the parietal cells which is present in the lesser curvature of the stomach. And the surgical treatment of the duodenal ulcer is highly selective vagotomy. In this, the parietal cells are denervated by cutting the nerve of Lateral, so the formation of ulcer decreases. Thank you.